mean by vulnerable when we're talking about COVID-19?
So the AHPPC has determined that there are several categories or population groups that are more at risk of serious COVID-19 disease should they be infected. So they're people that are older, so people that are aged 70 years and over. They're people that are aged 65 years and over with one chronic medical condition. If you're Aboriginal or Torres Strait Islander, that age cutoff drops to 50 years with one or more chronic medical condition. And if you have a condition or you're on medication, that means that your immune system is significantly suppressed. So there's a lot more detail about these conditions and the medications that we're talking about on the AHPPC website. So you can go there to see if your child or you as a staff member might fall into one of those vulnerable categories.
Okay, and if there is somebody who falls into one of those categories, what are we asking them to do that's different?
So if they do fall into one of those categories, or they think that they otherwise might be vulnerable and they're concerned about returning to the workplace, they should always seek advice from their medical practitioner in the first instance. Once they've got that advice, then they can talk to the school about risk mitigation strategies, things that can be put into place at school that might protect them. So for example, maybe their medical practitioner suggests that it's okay to go back to school but not have such a public facing role, so that perhaps there's some office administrative work that they could do where they don't have so much contact with other adults, for example.
So we're not necessarily saying that all people who are vulnerable can't go back to school or the workplace. What we're saying is that it's great to talk to your health professional or your healthcare provider and discuss what ways you can be kept safe.
Yeah, and your school will work with you to work through the options to keep you safe.
And what about for staff members who are pregnant?
So the AHPPC advice does not include pregnancy as a risk factor for more severe COVID-19 disease. So to date, it doesn't appear that pregnant women are more severely impacted by COVID-19, and that's from data from around the world and here in Australia. But we recognise that pregnancy can be a stressful time anyway, and someone will be concerned about returning to face-to-face learning in this circumstance. So in that case, please see your doctor, discuss your individual situation with your doctor and seek advice about what they think is appropriate in terms of returning to the workplace, and then again you can take that to your employer and work with them to come up with a strategy to meet your needs.